This video will demonstrate the protocol for socket grafting with flap reflection using Augma bone graft cement. For socket grafting there are two protocols. One with 4 bony walls, and one with a missing buccal or lingual plate. The protocol for a missing wall requires a flap reflection, as we need to put the material all the way down into the apex, and compact it well from all sides. Watch the following steps, from site preparation to closure. Site preparation. The site preparation in socket grafting with a missing wall requires a complete debridement and flap reflection. The vertical incision is performed approximately 5 mm from the extracted tooth and should not exceed the mucogingival junction by more than 3 mm. Then we reflect the flap by introducing the periosteal elevator 3 mm beyond the mucogingival junction. Please note that in the area where the buccal plate is missing, we introduce it as much as needed to expose the entire area. And then, in a 45-degree angle, we go laterally by 3 mm in all sides. Now we reflect the flap and then we are ready for cement activation. Cement activation. In order to place the graft, place the shaft in the palm of your hand. The other finger at the top of the cap. Start advancing the shaft forward so the liquid moves from the saline compartment to the powder compartment. Make sure that all the liquid from one compartment moves to the other compartment, and continue to push until the first piston reaches the line. The syringe is now ready for grafting. Grafting. Remove the cap with a twisting and pulling motion. Inject the material from the buccal aspect at a 45-degree angle, both occlusally and buccally. Immediately after, place a dry, unfolded gauze on top of the graft and press for 3 seconds from the buccal and the occlusal aspect. Take the periosteal elevator and compact on top of the dry gauze for additional 3 seconds. Now we are ready for suturing. Suturing. In cases of socket grafting, whether it is in the aesthetic or posterior zones, we deliberately do not close the flap because we want to grow keratinized tissue in the area and to preserve the pupilli. We do not do any tension-free flap, no periosteal releasing incision, and do not use any membrane or any additives like PRF. Just place the soft tissue directly on the graft. Now we position the flap in place by suturing the papillae first, papilla to papilla. Then suture the vertical incision. When we finished suturing the soft tissue, we will need to protect the exposed graft with Augma Shield, so that it will not wash out. We can protect it safely because the material is not prone to contamination due to exposure, and soft tissue will proliferate on top of the material. If the material breaks during suturing, take a dry gauze, press for a second, and then continue to suture. Closure. We will use Augma Shield for closure. Augma Shield has a matte appearance and comes attached to this transparent layer. We trim it to the correct size to fit the defect. Use a moist gauze on the gums before placing the Augma Shield so it can adhere much better to the soft tissue. As you can see, the Augma Shield adheres nicely. Please note Augma Shield needs to cover the entire area by at least 3 to 4 mm beyond the exposed area. We can place it again like in this case where it is only 2 mm. When the Augma Shield is placed properly on the defect, we secure it by suturing so it will protect the graft for 12 to 14 days. If we do not suture the Augma Shield, it will fall off after several hours. Use non- or slow resorbable sutures and refrain from using fast resorbable sutures such as chromic gut. We suture the Augma Shield with a cross-horizontal mattress suture, starting from the mesial aspect to the distal. Then proceeding to the palatal area, from the mesial through the distal. Then make your first knot. As we want to be sure that the sutures will keep the Augma Shield in place, we continue to suture by going through the Augma Shield vertically, like vertical mattress. Although we can suture in the border of the Augma Shield, do not suture in the middle of the Augma Shield because then it will tear. Then here again. Make sure the sutures are placed on the Augma Shield. Continue to suture by going back to the buccal aspect, going again as a horizontal mattress from the mesial to the distal. And palatally, from the mesial to the distal. Now you can make your knot. Postoperative instructions to the patient include avoiding toothpicks in the area and refraining from salt water mouth rinses, which will cause the Augma Shield to shrink. Any other mouth rinses are acceptable. With non or slow resorbable sutures, suture removal can take place after 12 to 14 days. To summarize, here are the key points for the socket grafting with flap reflection protocol. Site preparation. Make a vertical incision that should not exceed the mucogingival junction by more than 3 mm. Reflect the flap by introducing the periosteal elevator 3 mm beyond the mucogingival junction. Cement activation. Push the shaft slowly until it reaches the line. Grafting. Place the Augma bone graft cement in the site, slightly overfill. Compact from the buccal and occlusal aspect with a dry gauze for 3 seconds and add additional compaction with a periosteal elevator. Suturing and closure. Suture first the papillae and then the vertical incision. Place the Augma Shield and secure it with cross-mattress sutures as required. Do not use fast resorbable sutures and do not advise the patient to use salt water for mouth rinses. You can send any clinical question to info@augmabio.com and we promise to answer shortly. Thank you for watching.